All right, Jessica Evans. I'm here with Jessica Evans. She is a nurse and was diagnosed back in 2010, June of 2010, with stage 1 glioblastoma. And that
No,
was
Emma.
incidental.
It's
Just,
not a
oh, sorry, just glioma,
yeah, just
glioma. Yeah,
Emma.
okay. And it was an incidental finding after a car accident that you had had, right?
Yeah.
So you had had some symptoms prior to that car accident, like dizziness, and you had noticed some right-sided facial pain, and they were treating you for the dizziness. But
But
yeah, so just,
I was young and I wasn't having headaches or anything, so
yeah,
brain tumor on my radar at that time.
okay, yep. So, and you've been through a lot. You have been through 15 surgeries after having been diagnosed with the brain cancer. And I have some of the images that you shared with me, of, the first surgery and the shunts and the brain stimulator that was put
Yeah.
in. So I would love to hear about your journey, and I know others would love to, be inspired by you and hearing about how cannabis has improved your quality of life. So I guess maybe let's just start with the beginning, with the diagnosis and what you've been through.
Yeah, thank you. I appreciate it. So I had been working, I'm a registered nurse and was working at a local hospital. And so I had started experiencing some dizzy spells. So I went to the doctor and they had diagnosed me with an inner ear issues, and put me on some medication that frankly made it worse. So I just chose not to take the medication, and I'd be writing and I just noticed these little dizzy spells. So I just kind of adapted and overcame that. And then about 6 months after that, I started having these right-sided little zaps in my face. And so while I was at work, I'd put a cold compress on my face, and I developed this little rash from the washcloth. So they diagnosed me with shingles, and that kind of went on. And then I was injured at work, up my shoulder, and so I was out off on work on that, and was actually getting ready to come back to work the next day, and was rear by a 23-year-old kid that was texting at a stoplight. And so it was a pretty significant injury that put me in the hospital, and had the MRI and everything. And then the doctors came in and told me that they had found something on my brainstem, and they at that time they weren't real clear if it was a contusion from the injury. They were even concerned that I was having the vertebral artery dissection. Okay. So, they actually just chose to, keep me in the hospital and make sure I was stable. And then we just watched it for 3 months. And then after 3 months, when it didn't change, then they knew it was a glioma versus, a contusion or something. So, okay. I had been treated at a local hospital, KU University here in Kansas City, and they were going to do chemo and radiation because at that time they thought the tumor was too risky to biopsy because of the location. So I was fit for my radiation mask, bought my chemo. My sister had been doing some of her own research and had sent a copy of my MRI to Duke University, yes. Dr. Allen.
I was going to show that picture of you with your mask there. I was hoping it was going to be easy to do. I practice it. Let's see. So that first or the second one, that was your first surgery there. And then here was when you were fitted with your mask.
Yeah, luckily I didn't have to use that. So, because that was just being fitted for that is a pretty confining, restrictive issue, and so that was going to be clamped on my head every day. Anyway, I picked up my chemo and all that, and Dr. Alan Friedman ended up calling him personally on my cell phone and telling me that he thought he could help me, and that he wanted to resect my brain tumor, but he knew he could at least give me a biopsy and tell me what the pathology of the brain tumor was. And as being just being a nurse, I just needed to know, what it was. what type it was.
Before going down that route. Yeah.
Right. So my husband at the time and I flew out to North Carolina and had our meeting with Dr. Alan Friedman and chose to go that route and felt comfortable. So we flew back to North Carolina and had the surgery. That was in February of 2011 was my first craniotomy. So he was able to biopsy it, but at that time they, just the biopsy, I had to relearn how to walk I had to walk with the walker after that surgery. I couldn't use my right leg well. So, it wasn't that I couldn't, I didn't know what to do with it. It's like it was really heavy and I couldn't put it where I needed it to go. So I had to kind of learn how to do all that over again and stuff. So, had some complications from that surgery, had to have repairs to my dura 6 weeks after that surgery.
Okay.
So for 6 months, I still didn't get much better. I was actually getting worse. And then I was back here in Kansas City and was admitted in a hospital here in Kansas City. And that's when they found out that I had hydrocephalus, an increase in the cranial pressure. So my pressure was at a critical state at that point. So they drained off some fluid off did a spinal tap and drained off some spinal fluid. And that gave me some relief. And I was able to get back out to Duke in North Carolina. So in August of 2011, then I was shunted for the very first time. I have a VP shunt right here. VP is ventricular peritoneal shunt. So ventricular, it's in my brain here. My whole tubing goes down in between my breast and drains into my abdomen and then my body into my peritoneal area. And my body just reabsorbs that fluid. So, so that's why I've had so many surgeries was because of my shunt. I've actually had 11 shunts placed because they either malfunction or they'll clog with my own protein, things like that. So,
wow.
Yeah.
Wow. That's a lot. That's a lot of surgeries.
It is. And so after we kind of got the intracranial pressures, that a couple of years took us to kind of get this just where I could function and whatnot, but I still was having this increased, much worse than what I was prior to diagnosis. My brain tumor sits on my trigeminal nerve.
Okay.
So that's why I have this right-sided facial pain. Now we know. So, which I have the classic trigeminal neuralgia pain, which is those electrical zaps but I was having those like 15 to 20 times a day. And they would last like 30 and 45 minutes. So just debilitating pain.
Wow.
So I did so many different procedures to try and help with that. All different kinds of medication, pharmaceuticals, anti-seizure medications. I mean, just you name it, we've tried it. I had procedures, the sphenopalatine ganglion block, where they put a real long Q-tip clear to the back of my nose and they would drip lidocaine down it. So I'd have to sit there with that thing implanted in my nose for about 5 to 7 minutes while they dripped so much lidocaine in there and would pull that nerve. And that's I'd have to go in every 2 weeks and have that done. And that really helped for a while. And then it stopped working.
Okay.
So then I had surgery where they went through the roof of my mouth, through the foraminal valley, or through a hole in my skull, the foraminal valley, to damage the trigeminal nerve. Okay. Help stop firing those zaps. It worked. The first surgery, it worked great. And it stopped my pain for about 4 weeks, but then it came back. My neurosurgeon at the time thought, he was like, sometimes you have to have this repeat, let's do it again. There's such a fine line when they damage the trigeminal nerve that the second time it was almost too much for the nerve. And so it's left me in what they call anesthesia dolorosa, which is numb from, I feel like I've woke up from the dentist, from my middle of my ear to the middle of my face, and just like this area. So but I have like crawling pain, and that's constant now since that surgery. So that's why we end up doing the deep brain stimulator. Because I was wearing a 100 mic fentanyl patch. I was taking 8 Percocets. I mean, I was just, and I was functioning on all that, I obviously I had to give up working as a nurse in 2000. I tried to work, but then my shunt kept failing. So I had given on working and just trying to raise my family and live. So
yes.
yeah.
Wow. Okay.
Yeah.
So yeah, so you were on all of those medications, and so at what point did you start using, you started with the CBD first?
Okay. Well, before I get to that, just after they did the deep brain stimulator implant, I did get much relief. It was able to stop those trigeminal nerve attacks. So then I was able to kind of control my pain a little bit more, but with quite a few opioids. And so that's how I was functioning daily. And then my shunt had failed, and I had a surgery in January 2017, and just from that was my 10th shunt, and I just never recovered from that. And I kept saying, something's wrong with my shunt, something's wrong with my shunt, and they kept saying, no, everything's fine, everything's fine. And I was always 100% right every time I went to the hospital. I know when my shunt's not working. And that's when I had an issue with being treated as a drug seeker. It was flat out even called a drug seeker. And that was devastating. And especially being a nurse, because it was very, very hard for me to become a chronic pain patient on chronic opioids in the first place, because the stigma that was out there with pain anyways,
yes. And then to be called a drug seeker.
So I ended up getting in a very severely, for a whole year, I tried to get help with my shunt. And as a nurse, I requested my medical records. I just knew something wasn't right. So I requested my medical records, and I had found out that my shunt had been recalled. But the doctor had dictated the wrong type of shunt. So I was never notified of the recall. Wow. So I would contact with another neurosurgeon here in Kansas City, and once he figured all this out, he admitted me into ICU and put a bolt monitor in my head and figured out, kind of got me back going, and figured out that my shunt had been recalled, so he removed it and replaced it.
Okay.
And I was I think I was so severely depressed. I hadn't left my house in 25 days, or my house in 30 days, hadn't left my bed in 25 days. I was severely depressed and was done living. So I had to admit my psychiatric care.
Okay.
So I was just stripped and very vulnerable. When I came out of the hospital at that time, a friend of mine had sent me a bottle of 1,000 milligrams CBD. And I had tried CBD before, and I would take it a little bit here, and I'm like, that don't work,
Right.
So I never gave it a shot. I knew this was my life. I knew I had to take control of my health and take control of my life. So my friend sent me this bottle of CBD. I was like, I'm going to try this. I started doing a little research and looking it up. So I knew I needed to be very consistent with it. And I made a commitment that I was going to try it for 30 days, regardless if I felt anything or not. I'm just doing it. So that's what I did. And 2 weeks after I started that, I was like, wow, I've really cut back on my pain medicine. I'm doing good. So I just was noticing that trend. Well, in my research, I found that THC and CBD are kind of like a power couple. So I knew I could, for your pain, I could get more benefit by adding THC. So I had added THC at that point, and just gradually, it took me probably a year to wean off of all my opioids. I just make sure I did it and was able to not go back. So I was real gentle with myself and just took a really slow process. And so with CBD, I noticed what I like to say about CBD is it's an absence of, it's not a magic pill. What you're going to notice about CBD is, wow, I just feel better. Oh, I haven't been quite as irritable today, or wow, my pain's been controlled. I know, or CBD is great for my stomach issues too. So I notice when I miss my CBD. So
good deal. Okay, well, good. Good. But then you found greater pain relief, like the research shows, with the added THC.
Yes. Yeah.
And then within that time, back in on my birthday, November 6th of 2018, they, the patients voted, or the people voted that, cannabis should be considered a medicine. And so then since then you have cultivators, you have licensed caretaker cultivators growing for you, and have been using the THC then, and
Yeah.
CBD from that cannabis plant.
Yeah. So I have also, I haven't been able to work as a nurse for a long time. And so what I wanted to do was continue my while I'm off and trying to get back to living and get back to working, was to continue my education with cannabis. So I joined the American Cannabis Nurse Association and took their little online course. There's no true certification for a cannabis nurse at this time, but there's definitely education out there. And so I just chose to start diving in, that I can start helping people, because this has been life-changing for me. I got my life back because of cannabis, and it's truly life-changing.
Yeah, it gives me the chills. It almost brings me to tears too. I'm so grateful that you wanted to tell your story.
It's crazy to look back and realize that was me, that I lived through all that,
Yeah.
I try and downplay it, but then I was pulling up all those pictures to send to you, and I'm like, holy cow, wow.
Yes. And we can look at some of that real quick here too. Let me go to that screen share again. So there was the one about luckily you didn't have to do the chemo and the radiation with the type of cancer that you had. It was, you said, considered benign, but it was mixed tissue and.
Right, it's technically not cancer, but it's a brain tumor, and any brain tumor is not okay in the brain. But mine's a stage 1 and has a potential, and possibly has a characteristic of a pilocytic astrocytoma. So if it did grow, it would grow into cancer, but at this point, it's not. So
good deal.
Yeah.
And then let's see, I'm trying to get to that next image, and that was having to do with the shunts.
That's after one of my shunt placements.
Okay. And then the brain stimulator. I thought that was a really neat picture.
All the ones that are kind of curled up are the deep brain stimulator leads.
Okay.
The one towards the front and straight down is my shunt.
Okay. That little tube that goes down. Yeah. So, okay. And then they put a battery pack in, you were saying.
And I actually have a remote control. I have 4 different settings that I'm able to change, because what we found is, like, when I stay in one setting too long, it works great for a while, but then all of a sudden it kind of stops working. So we change it up, and I have a little remote that I can change my settings.
Okay.
So my brain doesn't get used to one thing, because it kind of like, okay, this stops it, and then it figures out a way to get around,
Yeah. Okay. Gotcha. So you just have to change it up and keep.
Yeah. I had to have my pack replaced after 4 years. I had to, because it had been in for 4 years, and so they just had to. I had that surgery. It's probably right out a year now. I had just had my battery pack replaced, so I'm good for 7 years now.
Good deal. Okay, so sort of every 7 years potentially you'll have that battery pack changed. Mm-hmm. Okay. Yeah. Good deal. Okay. And then let me just look at, I had my little list of questions that I want to make sure that I am not forgetting things that we wanted to talk about. So you've shared your experience with the CBD and the THC, and you ended up getting 2 certifications, meaning that you would have been allowed 4 ounces of cannabis with 1 certification, but having 2 doctors sign off on your certification that allows you to have 8 ounces of flower in a month. And so you have been using the Simpson Oil to help with the pain.
Yeah, the Rick Simpson oil about a year after I was on the cannabis. And since my, with the Rick Simpson's oil, it's the high THC dose that has been proven to, or that they're showing to cause the cancer cells to actually kill themselves. So since mine's not active, I just do a maintenance dose and just use it at nighttime to help me sleep. Or if I'm having a bad pain day, because I still have flare-ups. If I'm having a bad day, I'll definitely use my RSO versus just smoking. But just smoking the flower is how I get my instant relief with my nerve pain, because all those opioids that I was on before never touched it would take the edge off to where I could be functional, but it like truly controlled my pain. So I was living in constant chronic pain and just having to think that was normal. So once I've introduced the cannabis and even just the flower and then the RSO, it's just my nerve pain has just, almost settled to non-existent. And there was just here a couple of weeks ago where I was low on my medication for financial reasons or whatever, because it does. And so I was trying to stretch it out a little bit, and not consume as much, and actually didn't use my RSO for a couple of days and started noticing that my flare and my nerve pain was coming back. So it's definitely needed.
Yes. Okay. Yeah. And you had mentioned too about how before you were taking medications to try to help with sleeping, like was it Xanax and things like that?
Pill and Xanaxes, and still was not getting good quality sleep. Almost, I'm pretty sure contributed to my insomnia also, and all that. So, or my depression. So, good quality sleep was contributing to my poor health.
Yes. Yeah. Sleep is so important. So that's good that the Rick Simpson oil was helping you to have solid sleep then.
And the sleeping pill for sure.
Good. Okay. Then I meant to pull up a picture of the headstands that you do. So you have a wooden device. It's because you cannot do it you can't put the pressure onto your head. So you have this little lift device.
So yoga has been, and so with my brain tumor, I also have central vestibular dysfunction. So I have a little bit of balance issues and stuff that, I don't look like I'm drunk walking or anything, but I feel it. So I was having balance issues, and doing yoga has really helped and strengthened my core. And my daughter was into doing headstands, and she loves doing inversion yoga. Well, I do it because I have the shunt and the stimulator in my head. It's like when I try and do a headstand, I'm like, that's kind of awkward, uncomfortable. So I found an inversion yoga chair. And so I can do my headstands with that, and it's pretty neat. I'll have to send you some pictures, and because it really helped. And I didn't realize there's a lot of medicinal and beneficial to getting your body upside down and inversion poses, and the detoxification of the lymphatic system. And so it's just been helping me all around. If I have a slight headache, I'll get into my inversion chair, and I'm only in them for 30 seconds to 60 seconds at a time. I don't sit in 5-10 minutes of it. So just do these inversion yoga positions, and it just helps keeps everything in line, I guess.
Fantastic. And because some might say that it's contraindicated to do such thing, right?
With my shunt, I did have I think my body tells me everything. I checked into it first and made sure it wasn't anything that I shouldn't be doing with my shunt and my pressure issues. But I just let my body tell me. My body is the biggest indicator of what I can and can't do. And the fact that it's making me feel better, and I can actually be having a pressure headache, and I can put myself in that position and kind of, reset my brain, and it helps my headache and everything so settle down.
Mm-hmm. And I guess I want to emphasize the point about patients know what's going on in their body and they know what's best for them. And sometimes it's not heard. And then people have to suffer for a while. Like you knew something wasn't right and it was an issue with that shunt that needed to be recalled and changed. And then you end up being labeled a drug seeker, you know. And so I guess I want to just emphasize,
Yeah.
listen
Uh,
to
that-
patients because they
no,
know.
you're right. I struggled with that as being a nurse because I felt let down by um, my community, you know, healthcare workers. I thought they'd have my back, and then it felt like they turned on me. And so my shunt had been recalled a month after it was implanted. So, you know, that was really hard to come to terms with being treated. You have to be your own patient advocate. And getting, you know, just because the doctor says something doesn't mean it's the right thing.
Yes.
I know you need to be able to trust your doctors, but you also have to be able to be your own advocate or have a family member that can be your advocate and help you.
Yeah.
Anything you can do all natural. Looking back, I would have done things a whole lot different along the last 9 years of my diagnosis. Or 10 years of my diagnosis, I would have chose to do things a much different way. The natural what things are what has made a difference. All those surgeries, all those pills, I'm not sure that those were the best routes.
Okay.
You know,
Yeah.
best like time, and we were doing the right thing, but man, getting back to cannabis and an all natural plant that has all these wonderful medicinal benefits, and then getting back to yoga and doing simple things like the inversion yoga, and just taking time and putting myself first and putting it into my body.
Mm-hmm. Like, I guess maybe expand on that. Like, what would you have done differently as far as maybe, you know, different alternative approaches? Or
I would have looked into holistic naturopaths.
yeah.
Definitely would have went that route versus pharmaceuticals and surgeries. You know, some of them obviously were, you know, needed to be done. You know, but
Yes.
I just think I was raised in a time where anytime and being a nurse, it's like it seems like always natural. Anytime somebody says it's a natural treatment or a holistic treatment, try this, they got labeled as, oh, that's kind of weird, that's kind of crazy.
Mm-hmm.
So I kind of just turned, I wasn't aware of all the wonderful, awesome benefits to holistic natural care.
Yes. And I guess you know, so I want to bring it up because I worked in an integrative oncology research clinic in Seattle. And, you know, the research was comparing the people that chose just conventional approaches compared to people that, you know, incorporated the holistic and naturopathic approaches, which
Yeah.
include like diet and physical medicine therapies and you know, some of the botanicals and things like that, and you know, addressing structural integrity and things. And what the finding was with that study was that people reported improved quality of life, you know, when they included those other approaches.
Yeah.
So
Yeah.
so it is so important. I mean, I see how it benefits people just when they make simple adjustments in their diet, like, you know, reducing the sugar consumption, you know,
Yeah.
that will cause the pain. And
Yeah. That
yeah.
I had missed myself. I didn't take care of myself and my mental health. I was so worried about my physical health that, and I just would accept, okay, here, I'll take this pill. And then I was taking another pill to combat the symptoms of this pill. And then, okay, let's do this surgery. And then I'd need this surgery to fix something they did in that surgery. It was just a never ending vicious cycle. Yeah, it was rough.
Yes. Yeah. I can't imagine. Well, okay. Let's see. So just going back to any other questions that I might have to, uh, So I think what we want to emphasize here too is the importance of people becoming a patient in Missouri. And, you know, we know that there's research out there that shows the benefits of cannabis use with cancer patients and, you know, of course, with the chronic pain and things like that. And with, you know, that passage of medical cannabis in Missouri, it's important if we're going to be using that as medicine to, you know, be registered as a patient. And, you know, there are doctors in Missouri that are, you know, certifying people afford, you know, and it's affordable. There are some clinics that are charging, I feel, more than they should be charging. And I'll refer to the ones that I know that are not taking a lot of money from people. So I guess, so tell us, if, do you mind sharing your incident, you know, with
no.
law enforcement and how it benefited you being certified as a patient?
Yeah. So we were on a float trip last weekend, and the Missouri Highway Patrol, or Water Patrol, which is the Missouri Highway Patrol, pulled over our raft. They had spotted somebody on the raft smoking cannabis and pulled us over in a very aggressive manner. And they were in a motorized boat, and we had quite a few rafts, pulled us over, kind of weaved in and out. It was downright scary, because the way they kind of came at us, you would have thought that that we had really hurt somebody. So they pulled us over, and it was a 23-year-old girl, you know, very timid. And so two officers pulled us over, and they immediately started raising their voice and being aggressive, telling us, you know, that they saw us doing this. And so they found a little bit of a spent joint that had been smoked that was in the water. So then they chose to search all of our bags that was on the vessel. And I immediately said, I'm a medical marijuana patient. And he had looked through everybody's bags, and when he searched my bags, he did find my medical cannabis. And then was trying to threaten me that because he was trying to tell me that she was smoking one of my medical cannabis, and that I was going to be charged with a felony for sharing my medication. So I challenged him on that and told him that's incorrect. I know sharing medication is a felony, but cannabis isn't. It's technically not a prescribed medication, and it's not monitored by the FDA, you know, all this. And also tried to tell me that since I grow my own cannabis, that I'm not allowed to take it out of my dwelling. So at this point, I knew that he was uneducated on the article. Yeah, is it Article 14?
And the emergency rules. Yeah.
So, you know, we butted heads, and so then he threatened to arrest me and this and that. When he took my medication, I became very emotional. I had just remembered, had flashbacks of our friend Nolan when he had his cannabis taken from him, and just all that. So I just got super emotional that I knew I was a legal patient, and because I was on the river, I didn't have my medical card with me. Right. I did have phone, so I was trying to look up my medical card, my medical information, but we didn't have service, and it was sunny, bright. I was nervous. I couldn't see, and so I just said, I know you have access to. You have easier access than I do right at this point. Can you look up? So they did look up my card, and they gave me my medication back. Had I not had my card, the other people on the boat, one had a card and wasn't able to produce it from another state, was able to once we had service. So they all got tickets, and 2 tickets for paraphernalia and possession now that they have to deal with. Had they had their card, which all of them truly are patients, and you're using it for medicinal reasons. So we have to make sure that each and every person's going out there and taking the the right to have this medication on them.
Yes, and I think it's a learning lesson that even when you're just trying to enjoy nature time and floating down the river, it's not a bad idea to have a laminated card, medical card on you. Sadly, because they're out there with binoculars.
Yes, it was definitely a lesson learned on my part. You know, that still is considered public consumption. So, you know, that we definitely learned lessons along the way. But it definitely showed that law enforcement needs education on it too. And so you as a patient have to be proactive. You have to make sure you're legal in the first place, you know.
Yes. And I want to say something. I want to say thanks to Dr. Lisa Rourke, because yesterday she's owner of Cassville Dispensary in southern Missouri. And yesterday she hosted law enforcement to come to her dispensary. She has a very good relationship with law enforcement in Berry County, I believe it is, and, you know, help to educate people, you know, to try to prevent this waste of time and energy, and, you know, and just make sure that we're all on the same page and that they're informed about the legality and the rights of the patient. You know, so the one instance was, you know, that the police officers that had stopped you said that, oh, we just had training on this, and, you know, your medicine has to be labeled with the dispensary name and your name and all of that. And yes, that's true in the rules, but we are in this immaculate conception period where there are no dispensaries that are open. And so at this point, that doesn't apply, because you can't have labeled medicine. People are doing the home grow through licensed cultivation.
Wasn't aware of that. When he was telling me my medication wasn't labeled, and I said it doesn't have to be labeled because we're in the immaculate conception period and there are no dispensaries and blah blah, you know. So I tried to go into all this with him, and you know, he just was dead set on his way.
Yeah, he said something to you, right, about being very anti-cannabis.
Oh yeah. So once things kind of settled down, he did ask me about my patient story a little bit more, and I told him, and he shared with me that he has a family member, his wife's going to have brain surgery this week, or the next week, for some issue she has, and then his sister was looking into the deep brain stimulator. So he has women in his life that can use cannabis. And so I said to him, after hearing my story, and knowing, because at one point he did say to me, do you even really have your medical card? In a real condescending voice to me. And I'm like, I just told you I had 15 brain surgeries. I showed him my implant and that my port's still in my chest. Yeah. You know, I really going to ask me that. So anyway, after all this, I said, do you feel bad having to do this over a joint? And he said, no, I'm as anti-drug as they come. So my that something about my situation or our situation that day will stick on his heart, and he'll have learned something about cannabis that day, and maybe can help somebody in his own life. That's my prayer.
I hope he sees this story, you know, because, you know, that's why I'm doing this, and that's why I'm putting myself out there as a cannabis advocate, because I've heard time and time again, people coming off of their addictive medications, people benefiting that have cancer and are functioning people in society, and we need to stop putting them in jail, and we need to take them out of jail if they are in there for cannabis. And so I want to say let's just mention the Canna Convict Project, which is our friends Christina Fromer and Chris Smith, who, you know, she's a paralegal and has been doing such great work in helping to appeal for prisoners, and has helped to get some people out of prison for this plant.
I know. So amazing. The work he does is really good.
Really grateful to have, you know, to Christina and Chris and Lisa, and there's so many great people here in Missouri that are pulling together, and we're rising above this stigma. We don't care what you guys think, because you know, I would much rather somebody you know, be using this plant and even smoking it, okay? You know, I mean, sure, internal, great, then we're not affecting lung function, and, you know.
Yeah, I agree.
But I would much rather have them do that than stop their ability to breathe, you know, because of opioids affecting their brainstem. And we've seen way too many people die because of that. And you are, you know, evidence that you don't need, you know, these opiates, and that cannabis has been enough to relieve your pain, and people are not dying from cannabis. And so we need to get past what we were raised with the DARE program, and, you know, reefer madness and all of that, and continue to, you know, try to educate our law enforcement so that it is of their not a priority to them. There are bigger fish to fry than trying to take away people's medication. So let's see. I think we've covered a good amount. Is there anything else that you would want to make sure that is heard by people?
No, I think we've covered just about everything. Being your own advocate and taking control of your own health, putting yourself as a priority, looking into natural homeopathic treatments is, and like you said, incorporation. I'm not saying to turn away from conventional treatment, but definitely can be complements for each other.
Yes, you know, and that's how I was trained, is there is a time and place for the conventional approaches. And ideally, we're first starting with the lower force interventions, which is going to be addressing our diet, you know, and trying to make it nutrient dense. We're going to be trying to support our immune systems, you know, with using food, you know, potentially adding other botanicals in to help along with those systems. Addressing the mind component with counseling as well, and you know, addressing the structural integrity potentially with adjustments, like, you know, through chiropractic, and, you know, then going on to the higher force interventions if needed. And, you know, but ideally we're addressing those things, and people will have a much better quality of life. And I wish that was a part of our system, and I hope to see that in my life.
Yeah, I agree with you 100%. We definitely did the more aggressive treatments first versus trying, and forgot about my mental health, and that really needs to come with it. Protecting your mental health along the way, and starting lower and slower, trying more unconventional naturopathic treatments first.
Yep. And then sometimes we just have to have the surgeries, or, you know, we might have to have some pharmaceuticals on board. But, you know, it would be wonderful if there was more knowledge about these things that have less side effects that we can try first.
Yeah, so, I agree.
All right. Well, kind of hate to end it. I'm just so grateful to call you a friend, and, you know, thank you so much for sharing your story. And we just love you so much in our community. You make us laugh every day, and we're so grateful to have you in our life. So thank you for sharing your story.
Thank you.